Okay, my name is Melrose Stewart. You're here with me in one of the labs for the physiotherapy course. We're at the University of Birmingham and it's our open day. So welcome. I hope that in the next few minutes I'll be able to show you just a taster of the sort of things that we do on the course. So when students come to the university, we hope they're passionate and they are enthusiastic about wanting to do physiotherapy. But before we can allow individuals to start treating patients, working with patients, we have to ensure that their basic anatomy and physiology is okay. So we start off learning about the body, learning the terminology that's appropriate so that we can communicate across the multidisciplinary team. There's lots of online resources to help students. So part of what we want students to be able to do is to become autonomous, to be independent learners. And we know that there's lots of internet resources for you. And we use the internet to ensure that you engage with the course. And you can use that to engage with us as well. So apart from starting with your basic anatomy and physiology, physiotherapy has main core areas of practice. So we have neurological work, we have respiratory work, and we have orthopedic, musculoskeletal work. Some of the things that you will learn as part of the skills of your course is that you're going to learn to assess patients. And over here we've got two students, and they will show you a couple of the things that you might expect to be able to do. So for instance, we need to do testing of reflexes, so simple patella test, some of you, or a patella test, or a wrist test, or a test in the upper limb, and we will see whether you get a reaction. We can do sensory testing, so we have things like neurotips, small, sharp, blunt instruments to see whether somebody has normal sensation. You let the patient know, or the student know how it feels, so that you don't frighten them with the point. And then, you know, that is just part of an assessment package. Assessment is probably one of the most important things you'll do as a physiotherapy student. Once you know about your patient, then you can start thinking about, well, what can I do for that patient? We ask you to be problem solvers. And this is why we ask for those academic qualifications, because you need to be able to use them. You have a condition you've never seen in your life, and you've got to come up with a solution. So for instance, if a patient has abnormal balance, you need to be able to show them how to regain their balance. Can they stand without falling over? Can you challenge their balance? And you can make the lever more difficult for them, so you can work your way up the body and make sure it's more difficult. You can get them to put their hands above their heads and test the balance that way. You can get them to stand on one leg with their hands above in the air. So balance is all part and parcel of what we do. And then common issues that people find is use of walking aids. So if we have a look at the walking aids that patients often use, they are sent away from hospital oftentimes without being shown how to use a walking aid. And there's an array of walking aids, and patients are not even measured for their walking aids sometimes. So as physiotherapists, it's very important for us to ensure that if a patient is asked to use a walking aid, that they know how to use it properly. Now we've got different lengths. Yep. That's why we need physios, to ensure that they're using their walking aids properly. If patients can't walk, we have to use wheelchairs. So again, if you want to come over here, yeah, we have to show the individual how to use the chair, we have to show carers how to use the chair, and we have to show them how to put it in and out of the transport they might use. And so that's just a taste of some of the things we do here. The program is 3 years, it's lengthy, skills from day one. You're developing skills that you're going to work with patients. And we hope that if you come to Birmingham, that you're going to have a great time. You're going to have to learn with others, you're going to share the enthusiasm, all for the benefit of making patients better. So thank you for listening.